Hello class, this week we're going to get into a little bit more about EHR and MPI like we did last week. Some of the information systems that can be within the software that people use for documentation, and a little snippet on taking histories and what might be within a history that you can look for, especially applicable to those of you who are doing billing and coding. So you guys learned a lot about MPIs last week. MPIs are really important because without them, it's hard to know what records are in place. So if you didn't have a list of the demographics of your patients, it would be hard to know whose charts you had on hand. If different doctors are seen within the same facility, MPIs are really important so that multiple charts are not made for the same patient. So say a patient sees more than one doctor in the same hospital, they might already have some of those demographics down. And it's really helpful as well because sometimes in MPIs they have things like allergies and current medications. And those would be really good to know if somebody commonly saw a doctor who worked in the hospital, but was also admitted to the ER and was unconscious and couldn't give that information that was already in the system. It also helps to eliminate duplicate records, like we said, if they see multiple doctors or if they haven't been seen in a while, and also duplicate tests, because sometimes when a patient is seen for the same condition but by multiple different people, they might run the same test, and that's really expensive, and it's not best practices for the patient because they're constantly being sticked and poked and prodded or exposed to radiation in the case of x-rays and MRIs and CTs. MPIs also provide best practice recommendations, so there might be little reminders that let you know when you should screen for certain things. If it shows the patient's birthday, it could say, well, this patient is 50 now, you should screen her for colonoscopies. Do a screening colonoscopy, being that she's over the age of 50. So things like that to provide the doctor with best practice guidelines. MPIs can also be really important when somebody is doing a large-scale healthcare study. So if they're looking at a specific demographic of patients, they know what charts they can pull from. For disease registries, so if a patient is being seen by an oncologist and they're in an MPI system for a specific type of cancer, they can use that for statistics worldwide and saying, well, this many people in this hospital are being seen for ovarian cancer, this many people in this hospital, and so on. And also for natural disasters, keeping track of patients in an MPI system is really helpful in seeing how many people are affected by this disaster, and also give the rest of the country or the rest of the world good statistics on what kind of injuries or ailments could be coming out of this natural disaster. EMPI stands for Enterprise MPI, and it's just a little bit different than a normal MPI because it can link multiple MPIs together. If an EMPI is active, that means it's being used as part of the scheduling software. It's being used in the front office, so when a patient comes in, you're using the EMPI in order to figure out what patient it is. If they're using a passive EMPI, then it's used as kind of a backup to make sure that you are talking to the correct patient. So sometimes, in the rare case that a patient has the same birthday and the same name, it could happen, especially with very common names. There could be more demographic information in that EMPI that can discern between the patients. EMPIs also use algorithms to ensure that no duplicates occur. And they do this by deterministic algorithms where they look for exact copies or probabilistic, where there's enough information that is similar between the two charts that it's probably the same person. So either way, they alert the person who is running this eMPI when there are possible duplicates in the system. So once a patient is checked in via this MPI system, generally they are brought into a consult room where a history is taken. If you're working in the office, sometimes it's the medical assistant or even the biller and coder at times, depending on how many staff are in the office, that is taking the history and giving that to the doctor to interpret. And if you're not the one taking the history in your remote billing and coding, then you'll be looking at the history that somebody has taken. So it's really important to know what should be there, what to look out for, and different things that can help you in coding for certain things. So there will always be demographic information. Usually the patient fills that out before they even walk into this consult room. The person taking the history usually asks them for the chief complaint. Why did they come in today? Why are they looking to see whatever doctor that it is that you're working for? Usually they go through the LMNOP QRST acronym in knowing what questions to ask further for that chief complaint. So let's give the example of their chief complaint is a headache. So the first question you ask is L, location. Can you point to where your headache is? So say they point to the front of their head. M is for mechanism of injury. So that is, do you know how this headache came on? If the patient says, oh, I just woke up with it, well, that's okay. That would be the mechanism of injury. N can stand for a couple of different things. Usually I personally use it for neurological symptoms, especially being a chiropractor. That's more relevant to me than some of the other things that N can stand for. So you might ask things like, have you noticed flashing lights with your headaches? Any changes in your hearing? Are you more sensitive to light? Things like that. Trying to decide if it's a migraine or not. And she says, no, none of that. Okay. O is for onset. So you ask her, how long ago did this headache start? Oh, it just started this morning. Perfect. That would be the onset. P stands for two different things. It stands for palliative and provocative. Palliative means what things make this better. And she says rest, and ibuprofen. Provocative is what makes this worse. And she says pretty much everything, moving around a lot. Q stands for quality. So you ask her, if you had to describe your pain, what would you describe it like? It's best to not use leading questions like, would you say that your pain is dull or achy or radiating? Or it's best to not say that. So it's best for the patient to come up with the word on their own, because a lot of the times they'll be like, yeah, that sounds about right. So she says the quality is dull and achy. R stands for radiating or referral. So is that pain traveling anywhere else, or is it staying right where it is? And she says it kind of goes around to the back of her head as well. S stands for severity. So you ask her, on a scale of 0 to 10, 10 being the worst pain you've ever felt, how would you rate this today? And she says, oh, it's about a 5. And T stands for timing. So this could mean a couple of different things. It could be if you get headaches a lot, are they worse at a specific time of the day? Or have you ever had this before? And is this headache similar to your last headache? Is it worse? Is it about the same? Is it better? So generally, after the chief complaint questions are done, you move on to the review of systems. Generally, the review of systems is going to cover specific symptoms that are related to the diagnosis. So if she has a headache, the likelihood of somebody doing a digestive system review of systems would be low. You likely wouldn't get many answers that would contribute to the problem at hand. After review of systems, you move on to past and current medical history. Part of that would be sample. So it's another acronym that helps with past and current medical history. S stands for signs and symptoms. So are there any other signs and symptoms related to your condition? A stands for allergies, if she's got any allergies, especially to medications. M is for medications. So what are your current medications that you're on? L stands for last oral intake, and that's important specifically for diabetic patients if they're hypoglycemic. And E stands for events leading up to. Was she doing anything that could have brought this on? So it's kind of similar to mechanism of injury. Family history, especially for things that can be passed on genetically through immediate relatives. Things like breast cancer, diabetes, heart disease. Those are all really good to note in the family history. Social history would include things like, are you a smoker? Do you drink? How often do you drink? How often do you smoke? How much do you smoke? Exercise, diet, things like that. And then there also might be follow-up questions depending on the complaint. So we talked about MPIs, we talked about EHR. There's also what's called PHR, personal health record. And this would be something that the patient would keep track of. The patient can have their own personal health record either through their medical provider. Maybe they have access to all of their charts, and they keep track of that in order to easily facilitate their care through other providers as well. Or sometimes they have it as an app on their phone, maybe a Fitbit, where it tracks all of your steps and your heart rate and how many calories you burned. It can also track medical conditions. If you're over a certain age, it can tell you when it can alert people if it thinks that you fell. So those are really interesting features, and a lot of different technologies are coming out where you can keep track of your own personal health record. If you have an iPhone, there's even that emergency contact spot on your iPhone when you're in an emergency where first responders can actually access it, and it tells them if you're an organ donor, what your blood type is, if you have any medical conditions, allergies, anything that's really pertinent. Emergency contact information as well. But the only problem with things like these Fitbits and these apps is that they are not subject to HIPAA privacy rules. So although they contain a lot of your health information, and they're not supposed to release it, they're not subject to HIPAA violations if they in fact do have a breach. That being said, though, the likelihood of somebody wanting to know how many steps you walked yesterday is probably pretty low. So it's not like you keep things like social security numbers and stuff like that in your personal health record in an app. So as long as you're being safe and secure and smart, it's pretty valuable to keep a personal health record. So now we're going to dive into information systems. So these are all different types of systems that can be embedded into software programs, and usually all of these are together in one software program that can be easily used in combination with the electronic health record inside an office to kind of keep the office running. The financial information system is really important because it monitors the revenue cycle, and that's going to include accounts payable and accounts receivable. Accounts payable are any of the bills that your office is subject to paying. This will include payroll, any rent or utility, any expenses that the practice has to make. Accounts receivable is the money that's coming into the practice, so it's any of the bills that are being paid by patients or by their insurance companies. So the revenue cycle is going to be the balance between accounts payable and accounts receivable. And this will be important for coding and billing staff because they're going to constantly update the diagnosis and procedural codes, and they're in charge of the charge master, which is going to have a lot of these procedural codes. On the right here is an example of a charge master. It's going to have all of the commonly used procedural codes and diagnosis codes, their description, and the fee schedule that the provider normally charges for that procedure. So whenever these codes are updated yearly, the billing and coding staff will go in and change those, and that might change also the fee schedule that the provider charges for those procedures. The Human Resources Information System is going to track any employees and potential employees, and by potential employees I mean their applications, any information that they've submitted for hiring. It will also include any trainings that have happened to keep track of employees who have undergone trainings and who still need to undergo trainings. The Decision Support System is a system that uses models to run analyses based upon hypothetical situations. So for example, if you wanted to build an addition onto a practice, this would give you an analysis of what that would do to the practice, if it would bring in more money, what the cost and risk of that would be, and so on. The Executive Information System is used by administrators, and it's going to be so that they can view workflow and reports in a visually appealing way as graphs on a dashboard. So they can see how efficient employees are being, how much money is being brought into the practice, and so on. Patient registration, admission, discharge, and transfer is really important in the hospital and long-term care facility setting. It's going to store any demographic information and insurance information on patients that are being admitted, discharged, or transferred within the hospital setting. The scheduling system is going to control resources, especially in hospital settings, which is really important for things like knowing which rooms are taken, which staff are supposed to be in which area of the hospital, and which equipment is being used and when. If a scheduling system is centralized, that means that somebody would only have to call one number in order to schedule multiple things. If it's decentralized, that means that they have to jump through a lot of hoops and call a lot of different places to schedule multiple things. The practice management system usually is a combination of all of these that we just talked about, and it's the more common use of these information systems all combined into one. Materials management system is going to manage supplies and equipment, and in the hospital and long-term care facility setting that will include food ordering as well. So whenever something is running low, the automated ordering takes care of that, and it orders medications or equipment that are running low within that facility. The facilities management system is going to manage the physical plant, which means anything that is part of the facility itself, including things like the parking lot, the parking spaces, any of the foliage outside, and anything inside the building itself. So it'll track maintenance, HVAC, so if there's issues with temperature, thermostat readings as well, you would go to the facilities management system for assistance with that. So that's it for this week. Make sure that you let me know if you have any questions. Follow along with your book and with your assignments.